So have you ever wondered what your blood test results mean? This is part 2 of our 2 to 3 part series about what your blood results mean. We're here with Dr. George Touliatos, and we're going to discuss the next part of the blood test after this, so keep watching. Hi, welcome to Balance My Hormones, where we support men and women on their journey to optimal hormone balance. If you're new to the channel, please like and subscribe so you don't miss future content, and feel free to leave comments so we may address any comments, concerns that you might have. Today we're here with Dr. George Touliatos to discuss the results of different blood tests that we get from time to time. As I said earlier, patients want to know what the results are. Sometimes they get very fearful because levels are in red, and the red isn't always bad, it's not always good either. So we're here on part 2 to discuss, and by the way, Dr. George Touliatos is also a biopathologist, so he's the perfect person to discuss, a perfect professional to discuss what these results mean. All right, George, so welcome back, and we're talking about the biochemistry part of the blood test. So the particular test we're going over is our most comprehensive test with 67 different items. It includes full blood count, biochemistry, kidney function, liver function, bone screen, which is mostly calcium and uric acid. It goes into lipids, the full hormone panel,
cardiovascular,
thyroid panel, PSA markers on this particular test. So let's start with biochemistry. In our biochemistry section, obviously we've got albumin. I know that one, that's helping calculate your free testosterone, but what other purposes are albumin on the
Well,
blood?
under malnutrition, albumin lowers, in vegetarians also.
So malnutrition, albumin may be lower?
Veganism.
Okay.
Yes, the elderly people that are not well nourished, okay, not in well-fed state, they have low albumin, synthesis of proteins, anything, not just muscles, but connective tissue, hormones, peptides,
And
cells.
Albumin makes up the bioavailable testosterone?
Of course, yes, in the liver.
Okay. Then total protein. Should someone be concerned with the total?
Yeah, albumin is a protein. Total protein also reflects to the proteins you consume, okay?
Okay. And globulin?
Also is another form
of protein. Okay.
Yeah.
The other test that we have on here is HbA1c.
Yeah, the glycemic hemoglobin.
Yeah, can you explain that a little bit?
Yeah, so glycemic hemoglobin reflects to the average amount of glucose in the blood for the past 90 days. Okay. So it's not what's it today, what was in the past 90 days. So it needs another 3 months to change your lifestyle in order to see an improvement. Okay. Actually now most of the labs refer to 6%, 5.9, borderline over there to be diabetic. Personally, I'm precautious and I don't like to see over 5.5.
Okay.
So if you go from 5.5, they're heading towards insulin-resistant diabetes type 2.
So that would be more like 42 on the scale that we use in the UK.
Yeah.
So
I prefer to be below 5.5. Personally, I want to be 5 and below in order to improve your insulin sensitivity. A1C lowers by testosterone through muscle tissue synthesis, okay, by keto diet, and also by some supplements like chromium and lipoic acid.
Okay, that's right. What about vanadyl sulfate?
Vanadyl sulfate, yeah, absolutely, but vanadyl is no longer manufactured. Actually, it's a heavy metal.
Yeah, I don't.
It shouldn't be abused a lot.
That was
but
big.
We used to take it with meals in order to assimilate all the food stuff,
That was one of the supplements in the 90s. Yeah, I remember those, but yeah, you don't see that on the market anymore. The next one on the test is CRP. I think it was referred to before as HS, high sensitivity CRP. That's your C-reactive protein.
Yeah, we have the high sensitivity that elevates way sooner, but the CRP actually is an inflammatory marker, more sensitive than the erythrocyte sedimentation rate, and not affected by anemia, because when you have anemia, the erythrocyte sedimentation rate is affected by smaller cells. So CRP doesn't always increase in viral inflammation, in bacterial inflammation, actually more in viral, but
environmental inflammation. So CRP is elevated with environmental.
Could be also joint inflammation, cardiovascular inflammation to the arteries, or something deeper than that.
So this is good to look at the CRP in relation to lipids.
We know that cancer is a chronic form of inflammation, okay? It's a result of chronic inflammation. So perhaps in the gut, for instance.
But one shouldn't assume because you have an elevated CRP that you've got cancer.
No, but you could have progressive atherosclerosis, you know?
Right, so you can have...
Because atherogenesis means the buildup of the atheroma, which is the yellowish cholesterol plaque inside the lumen of the inner layer arteries, you know, that occludes and prevents oxygenation and blood flow.
So this is why it's an important one to have on the blood test.
Yes,
but
could be also arthritis.
Right, if that's elevated. Now I've noticed in the past
rheumatoid arthritis as well.
Okay, my CRP years ago was a lot higher. Of course, I had a little bit more body fat.
Hashimoto is also.
Oh.
Hashimoto elevates, of course, the antithyroid antibodies, but it's also an inflammatory process to the autoimmune inflammatory process to the thyroid gland.
Glucosamine chondroitin sulfate, there are a couple of studies that showed that could also reduce CRP levels by reducing inflammation, though it may not be that amazing for joint issues.
Well, turmeric I've heard of.
Turmeric, yeah.
Yeah.
Okay. All right, so that's CRP. The next set, we'll just do them together. It's iron, ferritin, transferrin saturation, and TIBC. So iron and ferritin,
with iron you oxygenate tissues, okay? Iron synthesizes hemoglobin, okay?
And ferritin is a storage?
Are the stores of the iron. Ferritin also can elevate under inflammation.
Okay.
Ferritin can be lowered by frequent phlebotomies or blood donations. And actually, iron, in order to be assimilated, it needs the catalyst of ascorbic acid, vitamin C. Otherwise, if you drink coffee and if you consume dairy products with calcium, you malabsorb iron.
So you won't absorb iron properly.
Yeah, that's why pediatrician, my sister says to the parents, don't give the iron along with milk, okay, or with yogurt. So it has to be apart, all right?
We'll go to CK, creatinine kinase.
Creatinine kinase is the enzyme of the skeletal muscles, or creatine phosphokinase in Greek.
Okay.
That also has another fragment of creatine kinase, MB, that reflects to myocardium.
Okay.
Creatine kinase can increase under vigorous exercise, under heart attack, and there you differentiate with troponin protein. And actually, it's a rupture of any kind of muscle. Either it's myocardial tissue, or it's skeletal muscle, contractile muscles.
Okay.
And it's accompanied also by LDH elevation, which is the cellular death.
Right.
Lactate dehydrogenase.
Next bit are kidney functions. Now, sometimes the calculation can be wrong. So for the EGFR.
For the renal function, we have the urea, the creatinine, the uric acid, and the GFR. There's a formula made out of creatinine. Now, creatinine elevates when you have a large body mass index, over 30, let's say, if you're a tall guy, muscular, to African Americans also.
What about if you take creatine supplements?
Creatine supplements, yeah, good point, because creatine metabolizes to creatinine. Not in all people, you have to hydrate well also. Avoid non-steroid inflammatory drugs, ibuprofen, diclofenac, mesylate.
Okay.
Avoid also central toxic antibiotics.
Okay.
And also, yes, as I said, hydrate a lot, but also animal protein elevates urea.
Animal protein, okay.
Dehydration also elevates urea. So when somebody wants to lower his hematocrit by drinking a lot of water, his urea also goes down. So there you see if you have consumed a lot of water because you dilute your plasma.
So you consume a lot of water, then what goes down?
Now the problem is that if you have a large mass, creatinine goes up and GFR goes down. So this formula doesn't apply to bodybuilders.
Is there a special formula for bodybuilders?
Yes, you collect your urine in 24-hour bottles, you know, okay? And then you give this to the lab and you ask for the 24-hour clearance of the urine, of the creatinine, in the urine.
So you get a urine test to look for the clearance of
creatinine.
Sample
of 24 hours.
Yeah.
And then you ask for the clearance of the creatinine in the urine.
Okay, and you would do that if
this is more reliable.
If there were too low of a level for EGFR, then if
creatinine can also lower by overhydration.
Overhydration, you can lower it. Okay.
Yes, and also kidneys and the glomerulus is mainly affected by blood pressure. As we know, kidneys regulate blood pressure through the renin-angiotensin-aldosterone mechanism, but bodybuilders who abuse steroids and who abuse also stimulants to burn fat, they develop focal segmental glomerulosclerosis that thickens the glomerulus, and then they cannot filter and they pee protein.
That's not good. All right, the next section is liver function. So, there's a lot of misunderstanding, or people think if I use testosterone, I'm going to elevate my liver enzymes.
No, testosterone is not toxic, the injectable, neither the cream. Now, the oral form, not the endocainate, which is andriol or restindol in oily capsules that are absorbed through the lymphatic circulation, but halotestin, which is fluoxymesterone, and methyl testosterone. There were 17 alkylated medications that there were the early stages of TRT in men. These are liver toxic, yes.
Okay.
Now, liver enzymes, ALT, ASTOs, AGOT, SGPT, may elevate also, as I said, by vigorous exercise, because they reflect the skeletal muscle, the liver, and the myocardium, because they possess all receptors for the transaminases, all right? Also under heart attack. So it doesn't mean that if you have elevated ALT, AST, you have necessarily pharmaceutical hepatitis, for instance. You just see the GGT, which is the intrahepatic damage linked to cholestasis and jaundice. So GGT, gamma glutaminotransferase, and ALP, which is alkaline phosphatase, these are the cholestatic enzymes that elevate under jaundice and yellowish of the scleras, etc. So no big deal if you have ALT, AST 2 digital. Now, if it's 3 digital, should be the use of statins that induce rhabdomyolysis, vigorous exercise, all right? Also, paracetamol, painkillers can affect the liver function, okay? But GGT is the real deal, okay?
Fine. That's the one
that increases also through alcoholism.
Okay. Total bilirubin? What?
Bilirubin now, total, increases under cholestasis. Indirect bilirubin increases if you have hemolyzed the sample. So basically, you put the blood sample into the tube abruptly, and you break through the needle the erythrocytes, and then you have this rupture releases bilirubin out of the red blood cells. But also thalassemia, this guy who has MCV below 70, means that his blood cells die sooner. That's why he has this pale color.
Okay.
So in such case, bilirubin elevates. Then we have the Gilbert Syndrome in pathology that is not pathological. However, under fasting conditions, you have slight elevated bilirubin without, of course, any yellow appearance of the skin of the eyeballs.
Okay, so that's the liver function. The next one they call bone screen, but it's essentially calcium, corrected calcium, and uric acid, which you mentioned under the kidneys. So
yeah, but also for the bones, you need to see the active form of vitamin D3, the calciferol 1.25 hydroxy.
Right.
Because this will absorb eventually the calcium. And if you take D3 supplements, you better take K2 alongside to direct the calcium into the bone tissue instead of to the arteries.
And then finally, I know this is one of your favorites, the lipid panel. So cholesterol, HDL, triglycerides, LDL, and then a couple ratios as well.
Yeah, but you may go further, deeper than that, for somebody who has predisposition.
All right, let's start with what's on this particular test, because we can order the more, the homocysteine and these others.
LPA, ApoA, and ApoB.
But so just basically...
But HDL is linked to triglycerides. So if you have moderate HDL, then you have also kind of elevated triglycerides.
Okay, so this particular chap has 5.65 for his total cholesterol.
It's close to borderline. Should be below 6, I think.
Yeah, below 5.
Below 5, yeah.
On this, and then he's got an HDL of 1.25, so well above 1.1.
It's elevated, yes. Usually, when you have high HDL, you have also higher total cholesterol and higher LDL. Now, according to the new standards, it's more preferable to have a super low LDL than a super high HDL, because even though the HDL is protected, that cleans the arteries, you should have low the bad cholesterol that clogs the arteries, okay?
Right.
So the statins work to the LDL and to the total cholesterol. However, they do not affect the HDL. And we have to know that the atheromatic index comes through the division of cholesterol to HDL. So no matter how much statins you take, if you have a nasty HDL, your atheromatic index is affected. So better keep your HDL high by niacin, eating clean,
Yeah.
have low visceral fat, and doing
Cardio?
regular cardio, and avoid smoking,
Okay.
over 40 at least, and do not abuse androgens because too high testosterone may lower HDL for people that do not eat clean and do not do cardio, okay?
Okay. So that's, and what
It's
about
very
the,
stubborn though, the HDL. You know?
Yeah, it can be. What about so the ratios you said, I think you're talking about
The
the
ratio
index.
of total to HDL
So-
gives you the aromatic index.
Okay. So
But
the-
also some people divide LDL to HDL, and I've seen HDL as high as LDL in some people, you know?
all right, so this particular level has a high total cholesterol to HDL ratio, 4.52, should be under 4. And an HDL cholesterol ratio is another, I guess, way to calculate
Triglycerides
it.
also are important to be kept below 150. You do this by essential fatty acids.
This is the on the American scale, 150 you're talking about.
Yeah, European also.
Yeah, the triglycerides are on this is 1.13. It should be under 1.7.
And also they're affected by fasting state, so you need to be fasted 12 hours for the
to have the
triglycerides.
lowest triglyceride.
Yes,
Okay.
and the day before consume only EFAs.
Okay. Now, we've had some of one of the labs that we've used say, you know, people don't go around all day fasting, I guess unless you do intermittent fasting, that, you know, your lipid panel will reflect
Not necessarily, not the HDL, not the fragments HDL, LDL, but the triglycerides are very
triglycerides
sensitive.
will be raised.
Otherwise, don't count them, you know?
Yeah, fine, fair enough.
Because you're gonna see a very blurry sample of serum, you know, yellowish actually, milkish.
Milkish. All right, so I think we'll leave it there for this particular video. We've got one more video coming up on how to analyze a most comprehensive blood test.
And we also have vitamin, I think, B12.
Yeah, we're going to go over that on the next video. So keep watching, and we'll be back on the next video. So hopefully like, subscribe, and we'll see you next time. Thanks. I'm going to do one more video on the rest of the hormones, okay?